Hi class, I'm Seth Turner, a fellow public health student, and I'm talking about depression-related suicide in adolescence. I first became concerned about this topic in high school when a football teammate of mine died by suicide. His death was devastating to my community, but I noticed many other communities sharing this pain with similar stories. Since then, I questioned why are kids killing themselves and what can we do to prevent it? Depression is a mental illness that can be characterized by changes to the brain that occur from negative life events, substance abuse, and sleep difficulties. These changes are often unconscious and occur during childhood trauma. Behaviors associated with depression are difficulty sleeping, social withdrawal, lack of energy, physical pains, appetite, and digestive issues. Suicide is often caused by depression and has its own warning signs, such as a fixation on death, disregarding physical appearances, and statements about dying. Depression is apparent in all age groups, and 1 in 7 high school students seriously consider suicide in the past year. This is a population that needs help. When looking at a prevention strategy, people need to be able to notice these signs and know how to get help for this person. This can be taught in high school students and teachers, as they will be the people around those who are struggling the most. One population that has a high need for suicide prevention is in the Cleveland Metropolitan School District, or CMSD. This area has the highest suicide rate of any school district in the country. An additional factor that plays into this high suicide rate at CMSD is that many of the students are living in poverty or are homeless. Financial stress is a common negative life event that can lead to depression and then ensuing suicide. These students desperately need mental health and suicide prevention education to help themselves, their peers, and their community. The educational program I am suggesting would be similar to the Question, Persuade, Respond initiative, or the QPR initiative, that teaches organizations how to notice suicidal warning signs and help the person seek mental health care. The training class lasts an hour, and afterwards there's a new cohort of gatekeepers for suicide prevention. If a program like this could be taught to all high school students, every single conversation could act as a shield against suicide. The health belief model and the ecological model fit into this program well. The ecological model of this program looks to acknowledge the social determinants of health that contribute to depression-related suicide. This program recognizes that it's unlikely to have an influence on the poverty level for the students, but instead it focuses on the education of mental health that the students and staff may be lacking. The health belief model will shift existing ideas about mental health and treatment to reduce the stigma. The program will provide free resources to reduce the barriers to care, teach about the susceptibility this population faces, and also increase the perceived benefits through sharing stories. The program itself will consist of high school students participating in 2 one-hour sessions every semester for 4 years. The topics for the students will include learning about depression and suicide, suicidal warning signs, free resources, and how to refer a friend for help. The school staff will complete a half-day workshop that goes deeper into having important conversations with students. Both programs will be incentivized for participation with free snacks for the students and a day of paid time off for participating staff. Some things to consider for this program is health equity. And this will be considered by providing free resources, such as the number for the Emergency and Crisis Lifeline at 988, and the Awareness of the Crisis text line at 741-741. Both of these resources are free for students. Some difficulties of this intervention will be the school district providing substitute teachers to cover for teachers' half days, as well as they will also need a trained professional to teach these classes. And in an area that is already under financial distress, this may be a difficult program to implement. My hope for this program is that it will reach several goals. First, by 2026, 90% of all teachers and school workers will have completed the training within the past year. Second, by 2026, adolescent suicide attempts in the CMSD will decrease by 50%. Lastly, evaluations of mental health beliefs before and after the program will need to be surveyed to demonstrate noticeable effects. This program can reduce the number of kids dying by suicide by using education to empower students and school staff to help struggling people. The people who are suffering the most will more likely reach out for help due to the reduced stigma in care. If a program like this can work in the Cleveland Metropolitan School District, then other districts around the U.S. could implement it. For me personally, I wish this prevention was taught when I was in high school so that maybe the warning signs from my teammate could have been noticed sooner and he could have gotten the help he deserved. And for people entering graduate school or those already in it or those teaching it, there's high suicide rates for our population, and it's important to take care of ourselves. So you deserve that. You deserve to take care of yourself. So thank you.